Michael here, October 4th, 2024. I'm going to bring you back 12 years. 12 years ago, 12 years ago, I had an appointment. It was right after Hurricane Sandy had hit, and I had a sore throat. So I went and saw someone. And of course, at this point in time, I was already involved without my knowledge. I had already been given what they call a outpatient civil commitment with no due process, no disclosure, no transparency, no opportunity to defend oneself, no opportunity to review evidence and then you know have some discussion. Nothing. I was railroaded. So after 10 years, 2022, Memorial Day, is when I found out about what was going on and why there was this endless baloney, endless weirdness. Okay, and I'm going to take you right now and share some of that weirdness with you. And as a matter of fact, it's going to illustrate the treatment plan, okay, which is essentially just gaslight Mike when he presents a complaint. Oh, you look fine, or everything's whatever, or you don't treat the person, you don't put it in the record, and of course it makes you look like you're showing up, and it's like, well, this guy's got a delusional mental problem. He thinks there's something wrong with him, and there's nothing wrong with him. Okay, so this was round one. So their goal, and we're going to explain, you're going to see it now. We're just going to talk about it. For 1 year, I had made numerous attempts to be treated for an oral infection, did not receive the proper treatment, okay? Or when I did see a doctor, they did nothing, made no comments, or even when I asked, I said, are we going to test and find out? I don't know what to test for. I've never seen such BS. A basic lab was all that was needed. It took a year for that to happen. A year. And I was extremely sick here in Missouri after a year, almost in the hospital from not being properly treated and getting the proper medication. So what happened in 2012, Hurricane Sandy hit, and I had a sore throat about a week before that. And I remember saying, oh, should I go in before? And I didn't. I said, maybe it'll go away. I'll wait. And, well, it wasn't. So I went in. All right. It was the very end of October. They gave me a medication, an antibiotic. My complaint was sore throat. After 8 days of taking the antibiotic, I was still like, I got the same exact symptoms, the same sore throat. So what does Mike do? He goes back in, and what is the physician's assistant basically do? He just looked and goes, oh, I don't see anything, and So more time goes by, and my tongue in my mouth is driving me crazy, and you can see from the photos there, I began taking samples, okay, and actually photographing them after growing a culture of what I was sampling from my mouth, and it was scary, nasty looking stuff, I mean, to say the least. So anyways, I bring 6 pictures. I go back into the primary care doctor, right? It's December 3rd now. A month, how long has gone by? Basically November, right? And October. 2 months have gone by now. So now it's really bad. The infection's bad. I have the photos. I got a stack of them, maybe 10, okay? The guy walks in and goes, oh, what's that? And I go, that's pictures of what I've been spitting out of my mouth. And then he goes, ooh. And this is all drama. He goes out into the hallway, turns around and goes, you're crazy, and walks off. How's that for treatment, huh? He knew I was coming in for an appointment. They were already networked. As of the end of October, I was, without my knowledge, being treated as a delusional mental case, and they were following a treatment plan of a psychiatrist who came up with a doozy of a treatment plan. Matter of fact, I'm going to be suing you on your treatment plan because you will not cease what you've been doing since here. How many years have gone by? 12 years this has been going on. So what happens? So Mike has already gone 3 times to the primary care and ended up on the 3rd appointment. You're crazy, as he walks down the hall, and this leaves me sitting there. So now I call my infectious disease doctor. He can't see me right away, right? Which is kind of unusual, I guess, in a way. But I had to wait for a couple weeks, and this is all part of the tactics, okay? Get you worked up. Now you're sitting thinking about it. All right, you're like, what the hell's going on? You're taking more pictures. You're constantly gargling and spitting the shit out, right? It's driving you crazy. I mean, if you basically had an athlete's foot infection of the tongue, okay? Now, you know what an untreated athlete's foot feels like? Right, and I had a fissure tongue. There was a split that formed because of it. So I go to my infectious disease doctor, and I bring the same 10 pictures. I put them down, right? And I said, Doc, what do you think of these? He goes, I don't know. I think you're getting a little crazy. I asked him, I said, is this more jello? I just asked the question. Is this? And he goes, oh, I know, Mike. I think you're being a little paranoid. I said, he's like, we're all getting exposed to things in our environment, he says. And I said, well, what are we going to treat this? I mean, what are we going to, are we going to do a test and, send a specimen so we can find out what this is? I don't know what to test. You know what the record said? Mike looked fine. Mike was doing just great. Yeah. Matter of fact, you would never know that anything was wrong. I mean, basically from what they wrote. In the meantime, I was totally flipping out over this. Okay? It was driving me crazy now for how many months? At this point in time, October, the end of October, was it? Yeah, the end of October. So we're talking November. We're talking a couple months. We're talking a couple months. So he doesn't treat me. I end up having to deal, and I'm like, well, who am I going to see now? So I'm over here. Hopefully, I get over this stuff. So now we're out of 2012. We're going into 2013. I go see a different doctor. Okay, one actually that a clinic in town that I had used. As a matter of fact, they were considered my primary care. They were part of the same company actually. I had been going to a North Haven one, and this one was in Hamden. Same people. Care Medica. I'll even give you their names. Okay? This time I have a female physician's assistant. And I'm really sick. And then she says, well, I can't treat you until I find out what's wrong with you. I mean, and you're like, what the heck? I told her, I'm really sick. I need treatment. And she goes, well, and she's like, well, I can't do anything. I'm like, what do you mean you can't do anything? She goes, well, if you have a problem, I says, maybe you could wait and see. The doctor's really, really busy right now. It's going to be a long wait. We'll just have to have you wait in the waiting room. And I'm like, I just extremely sick, extremely suffering from malaise. I mean, you know how it is when you're really sick. I mean, you're in no mood for BS. I told her, I was like, what's wrong? I really was upset. So I left, and that afternoon went across town to a clinic I'd used years ago. And I go in there, and of course, they treat me. Did they do a lab? No, they just gave me the regular typical treatment for your standard Candida. And of course, it didn't work. They gave me lozenges. They gave me, a few different medications actually. Spit and swish type, and swallow too. I mean, that is something you typically spit it out, but I had a doctor later tell me to swallow that, the one that actually did a lab and treat me for real a year later. So the medication would help a little, but it wouldn't work. So I go back, and then I go back. Now I'm going back to this clinic 3 times. They keep giving, and it's not being treated. It's just not. So again, I'm looking like somebody. It's like, what's wrong with this guy, right? So finally, I'm like, I go to an ear, nose, and throat specialist. He looks in. He was a Chinese doctor, very quiet, ENT, ear, nose, throat specialist. He just quietly looks in my. He has not much to say, you know, and just notes a slight irritation, an irritation of the tongue, basically. Doesn't come up with anything. Nobody had any answers for me. I just kept going back and back and back. I get here in Missouri. The first nurse I talk to, I tell her about it. I show her my tongue. What does she put down? The issue's been resolved. The issue I was having was resolved. So then I end up going to primary care in Missouri. And then she's like, oh, well, I can't help you. I need to give you a referral to your infectious disease doctor. Okay, a week goes by, I go there. What does the guy end up doing? He offers me a psychiatrist. I'm looking at him like, I've been sick for almost a year, dude. I'm having all these problems. And what? You offer me I'm thinking to myself, this guy's nuts. He's out of his freaking mind. So what do? I'm not going back to that guy. So what happens? A couple weeks goes by, and I'm really sick now. And I end up going back to the primary care who had sent me over there to the infectious disease doctor. And I go back there, except I'm really sick this time. And she didn't even walk in. She was an excellent nurse practitioner, by the way. And she should be. She had an excellent doctor. Believe me. Running her group and trained them. They were excellent. They were an excellent team. So anyways, this old doc comes walking in to deal with the situation. And I'm thinking to myself when he walks in, I'm like, thank God, an older doctor. I mean, today's my lucky day, I'm thinking. So anyways, he does a lab. The record indicates it was per my request. I don't remember requesting it, but I might have. And of course, I was really like flipping out at this point. I've been sick a year. I'm really sick. And what comes back? 2 infections. A normal Candida, and the other was Candida dubliniensis. I'm going to have to write that for you. It's tough to pronounce. It's easy once you see it in front of you, though. So it needed a completely different medication. And nobody had prescribed that medication because they never did a lab. And the question is, how do you go to 10 appointments and nobody does a lab, and the guy keeps coming back and keeps coming? Wouldn't it be standard operating procedure to do a lab? Shouldn't the first guy, the very beginning, all the way back in October, late October, when I went in there, he should have done a lab when he prescribed me the medication. Who knows, something else might have come back. If he had done a lab within a couple of days, he would have called me up and said, Mike, stop taking that medication now. You need to come in here. We need to give you 2 antifungals. And it would have been done. Okay? But they had a plan, you see, because they're networked and they're following a team. Okay? I have a comprehensive, intensive care team because Mike is so fucked up in the head, he can't do anything right? Oh, he needs a team. Well, let me tell you, you people did a job on me, and we're starting right now with the Candida. Okay? In a courtroom, you're dead. What excuse do you have, especially when you match it up to your treatment plan? Your treatment plan is incredible. It's essentially gaslight Mike, make Mike look like he's mental, like he's delusional, like he doesn't have any problems. And then if he does brush it under the rug, minimize it. Incredible. So the story continues, right? Now I'm really sick. I mean, I thought, matter of fact, the doctor, after when he got that lab in, he called me at home and he told me, he says, because he knew I was sick a long time, he said, if this doesn't improve, he says, we're going to have to give you a very powerful antifungal via IV, and that, of course, probably would have meant in the hospital. I was really close to being hospitalized. I was extremely sick. In 2013, my birthday, I wouldn't even eat a piece of my birthday cake. Okay? Yeah. So now we'll go forward. Mike ends up being referred to another ENT. And what does he do? He plays the whole game, and he gives me a referral to a periodontist. A periodontist. And he goes, burning mouth syndrome. Really? You had the lab. You knew the lab existed. I had 2 forms of Candida for a year before it was treated. And you have the nerve to send me to a periodontist and give me a nebulous, oh, it's a burning mouth syndrome. We really don't know what causes it. He was playing the psychiatric game. So now, because I got rid of the first infectious disease doctor, who I originally wanted to send me to a psychiatrist, I said, well, he's nuts. I'm out of here. I get another one. So now he treats me, same for Candida. He gives me a short course. I guess he wanted to make sure. And then they went right to work on me, okay? Right into the next issue. All right? We're not going to get into that because I want to keep this specific to Candida and to the period of time from October 2012 until the end of 2013 before I ended up with the new infectious disease doctor and, the name of the organization, APO, okay? So, in a courtroom with all your records laid out, what are you going to say? Your treatment plan is to gaslight Mike. You're still doing it today. Your gaslighting almost put me in the hospital. It kept me sick a year, and a couple of times I was really sick for a while. Okay? Almost made it to the hospital. If that doctor had not pulled a lab and you guys kept playing your delusional mental illness game, I would have been in the hospital. I might have even died from this stuff, from being not treated. I swear. What is wrong with this country? As a matter of fact, what is wrong with the medical system? That's what I want to know. Currently, I have no doctors, okay? I have an infectious disease doctor who released me from care in 2023 saying, well, you have asymptomatic HIV. There's really no reason for you to see me. And, and so she releases me from her care, but yet she's still subscribing me to medication. Okay? So I contacted her and said, well, I have no doctors. I just terminated the PCP, the primary care provider that I had, that I kept, because it's not them. It's the system. It's the team, the comprehensive, care team, the intensive care team, because Mike is just so fucked up, okay, that, oh my God, he has to have a team. And all you people have done is stonewall me from getting appropriate treatment while you've enforced a outpatient civil commitment that, boy, this is going to be challenged, pals. It really is. We're going to have the fight we should have had in 2012. You don't just grab somebody off the street, declare them mentally ill in secret, following them around, telling everybody around them, oh, he's mentally ill, he's delusional. Oh, here's the treatment plan to all the doctors who are all networked with a coordinator in the team, of course. There's a coordinator, right? They're coordinating everything. You coordinated my illness to document, to create the documentation you needed for your stinking contracts to keep me in that Part D. Okay? Mm-hmm. And to justify and to document how, well, the treatment plan and the assessment and the diagnosis of the psychiatrist, psychologist, whoever they were, is correct. Mike is delusional. Now, can you imagine? I can't be trusted to go into a doctor's office and say, look, I got a problem. I got this going on. But yet I was walking around with firearms? How's that? Oh, no, he's so... And not only that, you should see how they treat a delusional patient. I found out all about that after 2022. That's when I said, I'm out of here, Jack. I ain't delusional. And you know what? There's no way I'm going to cooperate with this shit. Okay? I'm going to tear your asses up. One section at a time. This Candida is a joke. Okay? Really is. What you people did and how it's related to your treatment plan and diagnosis, which you could take and stick where the sun never shines. I'm never going to go along with your shit. I want to sue that shit out of you people.